Could you please call the do a roll call? And I'm calling the meeting to order.
Yes, of course, Commissioner
I'm
Chung.
I'm still getting over my COVID brain.
Commissioner Chung,
Present.
and we're glad you're here, and thank you for all that you've been doing while you've been sick. And Commissioner Guillermo.
Present.
And just for you all to know, I have a sty in my eye, so my eye's a little swollen. Just I'm fine and don't need to worry. I will read the land acknowledgement. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who were the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land, and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone and by affirming their sovereign rights as First Peoples. The second item on the agenda is the approval of the April 5th committee minutes.
Do we have the motion?
I'll move approval of the minutes.
And I'll second.
There's one person on the public comment line. Person, if you'd like to make comment on this item, which is item 2, the minutes of the April 5th committee meeting, please press *3 now. All right, there's no public comment, and commissioners, I'll take your motions as action so we can move forward with item 3, the monthly contracts report.
Thank you.
Hi, good afternoon, commissioners and Mark. And just before I start, I want to announce in great news that Rob Longatano, who's a long time amazing employee that has worked in the Department of Health Contract Office, has accepted the job as the director of the Contracts Office. So I don't know if Rob, you want to camera yourself just to say hi. Maybe you'll get Rob to do these in the future. But oh, you're not coming. Well, anyway, that was my announcement. I'm very happy. So everything that I've probably forgotten today, things will be looking up as we get staff in place.
Yes. Hello.
Hey, I don't, oh, yeah, okay. So I'm going to jump into the contracts report. And there's representatives here for the contracts. I have some of the answers to the questions that Commissioner Chow provided, and then the representatives also have or will have answers that I don't. But the first contract is the Regents of the University of San Francisco, and this particular program is UC Alliance Health Project. The contract, the reference says CHEP, which is one of our divisions, but it's actually really HIV Health Services. So our representative is Dean Goodwin. But this is pretty straightforward. You've approved it before. We are just doing an amendment to extend the term and to add corresponding fundings to continue to do the same services. And I'm going to turn to Dean because I didn't follow back up with him, but I know he has, I hope he had the questions. And there was a question about the one-time funding going beyond the current contract. Are you there, Dean? Do you know?
Good afternoon, commissioners. So we added, there are 2 pots of one-time funding that were added to this contract. One is for $231,765. That was unexpended from the previous year and rolled forward to support some expanded services at AHP to better meet ongoing client need there. And then one pot of funding here identified in this report as one time is for $74,803. And that was actually an increase in the funding for the long-term survivors element. The Board of Supervisors added funding to HIV Health Services to support a growing need among long-term survivors for more access to mental health and psychosocial support services. So we allocated that funding to the 5 community-based organizations providing mental health and psychosocial support. That amount was increased this year by just about 40%. So this is an increase to that funding. So that 74,803 will continue. That'll become part of their base for the long-term survivor mental health funding. I just wanted to provide that update based on Commissioner Chow's question. Any other questions?
I don't think there's any question for this one. Maybe we can move on to the next one. I think that there might be questions coming for the next one.
Okay, thank you. The next contract is Asian and Pacific Islander Wellness Center, doing business as San Francisco Community Health Center. So this contract is an amendment to extend the contract by 1 year. And primarily the expansion is to accommodate the mayoral declaration, which is to add services or to expand their existing services to support the mayor's Tenderloin emergency. And the question was to describe more about what was being provided specific to that. And I believe Nicole Trainer is on here for that explanation. Yay.
Yes, hello everyone. Hello, commissioners. So the services that will be performed by the Wellness Center are services that are directly related to the Tenderloin Linkage Center. There'll be referrals from outreach staff that will be made to the Linkage Center. These resources and referrals include housing, nutrition. They provide pet support. They also have public benefits services. Showers are provided at the location. And I believe there's laundry services that have also been implemented at this particular site. There will be healthcare services provided, such as mental health care services, substance use care, harm reduction supplies, and services. And then there will be other emergent and urgent services that will be put in place once this contract is certified, and we have the subcontractors of Cold Tenderloin on board as well. Are there any additional questions about the services at the Linkage Center?
I had one,
Yes.
probably, hopefully quick question and answer. The subcontracting services that the Independent Arts and Media
Yes.
group will provide. So it, just so that I understand, it's the relationship between the Independent Arts and Media and the Center for New Music. I'm not sure.
They're acting as the fiscal agent for Cold Tenderloin, who would be providing the services.
And what type of services will those be?
So the services that I just described would be they will be providing services from, I believe, 6 a.m. to 10 p.m. at night. They will be fully staffing the Linkage Center with the support of the SFCHC. So right now, SFCHC is also providing linkage and care services. And then once this contract is put in place, we'll have additional support from the agency Cold Tenderloin, who has a stronger connection with the community and has the capacity of staffing to provide the full range of services on an ongoing basis.
Okay, thank you.
You're welcome.
Thank you.
So I think that for me, this is more of a comment than a question. So though, like it started in my head as a question, it's because of the amount, like that we are adding to this contract. It's almost like, like might as well be a new contract just for the 1 year. But I assume that, like this is after this 1 year, there will be a new RFP out. Is that correct?
I cannot speak to that. I can find out more information on continuation of funding, um, but I don't have that information as far as whether or not these funds will be RFP'd out or not. But I
Yeah.
can follow up with that.
Yeah, because like
Okay.
my concern, like from the angle of like being, like someone who had done direct services, that's a huge expansion. You build the capacity of
Mhm.
this program by over 1,000%. And then if this ends in 1 year, like I think that there's also economic implications. So, and yeah, and
I
I'm not trying to say how people should run their budget, but
yeah,
like if you hire more people to do this, like after 1 year, then you have to be able to like figure out how to disband the people that's hired to do
ab-
this.
absolutely. This is sustainability is key, and I agree with you. One of the things I do want to point out is that Cold Tenderloin also provides a lot of these services at a lower scale, so they have the sustainability of that organization, and we're adding these funds for them to build the capacity. And yes, the hope is that this services can continue past a year.
I mean, it's a worthy project, so don't get me wrong.
Absolutely.
But
Yes.
when there is such a big annual difference, I think that
Mhm.
it just raised a lot of like questions, from those who haven't been following the news or who are
Yeah.
not familiar with this budget.
Yes, yes, I definitely agree with you, Commissioner Chung. I will go back into leadership and explore this and provide you all with an update via email.
Yeah, I just like to know what's the follow-up after this 1 year.
Okay.
Yeah, and I would like to support Commissioner Chung's concern about sustainability. Again, given the the large increase, and I know it looks like a lot of these will be subcontracted services to other organizations that probably have the capacity, but it would be the same thing. I mean, you're bringing people on to do
Right.
some services and having an expectation of of services, and then
Yeah,
after a year, which goes by really fast, what happens?
absolutely. Absolutely. Completely agree. Yes.
Thank you.
Mhm.
Should we go to the next contract?
Yes, I think we're ready to move on to the next contract.
The next contract is the San Francisco AIDS Foundation. This is going to be similar to many, many contracts that you have seen that we've been extending by a year in order to get the solicitation in place. So this is the last extension. It's 6 months, and this allows time to finish up all the last details and implementation planning following the completion of a replacement solicitation.
Mm.
Commissioner Chow was reading from, he said, a small screen. So I think in the fine print, the contract is only 6 months, and that is why the dollars are, that's the reason that there's an annual reduction, is to reflect the 6-monthness of term of the contract.
Any other questions, commissioners? All right. I think we can move on.
Okay. The last contract is, I think, yes, Felton. And we have one representative here, but I also, the person that could answer those questions gave me the responses because he wasn't able to come. But Felton Institute this is a large contract, and what we're doing is extending it, or proposing to extend it. It's ending June 30th, 2022. We want to extend it through June 30th, 2027, and then we're adding the corresponding funding to keep it going through those remaining years. And those are the remaining years authorized by the solicitations that authorize those services. So some of the questions that Commissioner Chow had was he noticed that some of the units of service are calculated by minutes and others are in hours, and is there a different type of services? And so the response to that was there really isn't a difference. Some services are billed in minutes and perhaps converted to hours for easier reporting, but it's the same difference. Then the next question was also case management costs about $13,639 per year. It seems very expensive. Please give the rationale for the cost. And these services are adult intensive case management for clients, so it is an expensive service, and the price is in alignment with similar programs, so it doesn't stand out as higher. Then the question was adult FSP, full service partnership. is $17,360 per year. So why this cost? And so the response from the Paul Lamb, who's the director of this system of care, the intensive case management, he said it is higher because there's an extra requirement. I didn't get there's an extra requirement to have access to a 24/7 call line, and then extra funding for client-related expenses for groups and other activities. And then the question was, for about 1,000 to 1,500 per month, can you provide an average of the types of service for each of these clients? So I don't think that he didn't have an average, but he talked about that the wraparound services, they include more than one time contact per client. So it really ranges. They could be getting case management, which would be bringing the client to link with needed social and or medical services. It could be psychotherapeutic interventions, crisis de-escalation, medication support, coordinating care with other providers. So their goal is to try to meet the client where they are in terms of their needs. And so I think it's a range instead of an average. But that's the types of services that they receive. And then the last question Commissioner Chow referenced is that there's an item for capacity of services of 685 hours, and what is the cost? And that program is not intensive case management. What that is it's a capacity building / clinicians academy that provides training to deepen the understanding of master degreed clinicians and waivered providers in working with this population. So the 685 hours includes teaching time, individual coaching, and the total cost is $226,500 annually. And I think that was all the questions that he provided. Do you have additional questions or any comments?
Commissioner Guillermo, do you have any question?
No, not specific to the questions, I guess, that Commissioner Chow had asked. Yeah, I'm fine.
Yeah, I do. So like in terms of the case management, so I'm assuming that, like those who are staffing the case and managements are all trained professionals with advanced degrees. Is that correct?
I would suspect that, but I'm not going to guess. Is Jenny, Jenny Hua, are you on that? Do you happen to know?
Yes, for the case management, we have master level trained staff. We also have peer navigators, we're peer counselor who are trained. We went through the peer certificate program. And so we work as a team, with the doctor and the nurses and all that, and doing whatever it takes to make sure the client stays at that level of care and not decompensating back to the hospital. So the staff are well trained.
So I think that's where, like maybe that could have a little bit more clarity in terms of, the reflection of that budget in terms of the case management, because, like of the fee differences, that it didn't reflect that here. It just say case management and, a total cost, and it didn't really say how much were performed by advanced degree staff, or how much of these are performed by peer navigators. So I think that it would be really helpful, like for future reference. So, I think that it just helps a lot to understand the breakdown, and so I think that if you have that breakdown, then Commissioner Chow might not have the questions that he asked earlier about the case management cost.
Great, thank you.
So, okay, so do we have do I have comments on the?
There's no one on the line. Point, Commissioner. Thanks for asking.
Okay, so so do we have a motion to add this contract report to the consent calendar?
Uh, motion to, do we approve all of the contracts?
So
together?
what we do is like
Yeah.
we add this to the commission's consent calendar, and
Right.
then the commission vote on that to
Right.
accept.
So again, it's the whole report, right?
Yes.
Yeah. Okay, yes, move to recommend the report to the consent calendar for the full commission.
Thank you. So, and I second. So we will add the report to the consent calendar.
Thank you both, and thank you those who supported this presentation. We can move on to item 4, a request for approval of a retroactive new contract with Dolores Street Community Services.
Is it Nicole? Is this your contract? This is this your contract, Nicole?
Yes, yes, it is. Yes.
There you go. So for this, as you guys can see, and Nicole is here to answer any questions, but this is a request for approval of a new contract with Dolores Street Community Services. And it is for COVID-19 response. And just because I'll just answer this or say this and then turn it completely over. But the reason that it's retroactive, because I asked, why is this retroactive? And it's retroactive because it took, once the funding notification, once it was determined exactly what was being funded, and then the funding notification was issued, then it just took a long time to get the service scope nailed down, and then the contract developed. But by the time it makes its way through the process, there's a budget that's for 12 months of this year, and they have expenses against occurring in some of those months. I'm sure not up to this total, but so if we were to go back and change the contract budget to start later, it's just it's a circular process that we can't get caught up. So that's why it's being presented, so that you'll see what the full budget was and why it's retroactive. But I will turn it over to Nicole to speak to what the program is.
Great. Do you guys have any additional questions regarding the contract before we give a brief overview? And I also have my colleague, Thomas Noble here. Thomas, if you want to speak to some of the programmatic level descriptions as far as what services will be provided and the priority population, I think that will give the commissioners a better scope of the goal and the intended outcomes of this program.
So I did have a question though,
Sure,
before you
yes.
start, Nicole. So just trying to again understand the retroactivity, of the contract. So one question is, what are the kinds of things that had to be negotiated back and forth that delayed the contract? And then the other is, if there were expenses incurred prior to this that sort of show up and you didn't want to go back and sort of rebudget, is it possible that in the future there might need to be a modification to cover either expenses that weren't captured, or to somehow, I guess, level set, the actual cost versus what the budget was, since they didn't sync up?
Do you want me to?
That's a great question, by the way.
So that, just to, and Nicole and Thomas, you can answer, but in general, they're only they'll have invoices that match that budget. So, and the invoices tie to the line items of what was agreed upon. So there shouldn't be services that are outside of the contract. If there were services that were outside of the contract, then yes, a modification would occur, but there shouldn't be any that's outside.
I'm not talking so much about the services. I'm talking about the cost of services.
Okay.
Yeah.
So the budget will tie, and it will show what the cost is, or like an hourly rate, or whatever that cost is. Whatever's in that budget is going to go onto invoice templates,
Mhm.
and they're going to report actual costs.
Mhm.
And so they may not have any in July or August. I don't know when their actual anything started, but whatever month that's in, they'll bill it using that invoice, and anything that it's not an automatic payment. They have to show an expense in order to get reimbursed.
Mhm.
And so I don't think they'll go back and revise it, but the detail, unless there's a change. But otherwise, they'll just get paid what they earned.
Yeah.
Yes, so about that, I think that that's actually what my question is, because this is retroactive. The term is retroactive to July of last year. And it would make no sense, that if they are going to do back billing to all the way to July of last year, because you just determined, the scope of services. So it's a little bit confusing, like, and on paper, that, like that it's not quite, how do I put it? Yeah, so the annual budget, like half a year is gone, and so it would likely that they will underperform because of all these changes. So how is that going to reflect on the actual budget?
They'll only get paid for what they earned. And so if they don't generate services that are equal to the budget, we typically, and when you get an add back or like COVID funding, it comes on a fiscal year, which is somewhat problematic, but then COVID hasn't ended. It just went into the new fiscal year and this contract was identified. So the funding notification goes out that incorporates that year. And then I'll let these guys speak to what challenges they had in developing the contract, because I don't know what scope issues, but a lot of COVID services have been uncharted territory, which have required a lot of city attorney
Mhm.
input and assistance. But I'll let you guys.
Great. Thank you. Thomas, could you speak to the programmatic piece and the startup with the agencies and some of the barriers that were faced?
For sure. So,
Thank you so much.
commissioners, I appreciate your energy. I actually, if I'm interpreting it right, you're looking out for the agency and wanting to make sure that they get paid. So, Michelle kind of indicated the fact that it was COVID. Things were confusing, and specifically, we engaged this particular organization just due to the fact that the monolingual Spanish-speaking community was so highly impacted by COVID, that we engaged them early on in case investigation and contact tracing work. And in the middle of all of that, about 2.5 years ago, we got the opportunity to get this funding, and we just didn't know what today would look like back then. So much has changed, and we have charted a course forward with regards to trying to address other disparities that were uncovered during COVID. And so what we want to do is kind of take those on, is what I'm kind of defining as COVID legacy projects that were kind of the best practices of that work. And what that looks like at this particular point with Dolores Street is we are actively reaching out to people who are have diabetes or pre-diabetes diagnoses that are coming up. It's actually a co-screening process with COVID at Unides de Salud, which is one of the organizations that we are working with by UCSF. And we've seen a 20% rate of Latinos in that particular neighborhood being pre-diabetic or diabetic and needing resources to address that. So Dolores Street is actually helping us kind of use the case investigation and contact tracing model that we did for COVID and applying that towards addressing diabetes in the mission. And our future vision is to actually continue to build that out to address other disparities that are impacting populations in the city and county of San Francisco. So the nature of the contractual stuff was just the fact that we were in uncharted territories. We were working with an organization that was highly impacted by COVID and almost a sustained state of crisis, to be clear, and at the same time continue to show up and deliver 120% of what was needed in the community. So I'm not sure if that answered the question or if you have more questions about that.
Thanks, Mr. Noble. It's good to see you. And I think that this is where we need more discussions because it is, like you said, it's very confusing. That they, like this is retroactive, but if they are on the billing systems, like how on earth are they going to like really recover the cost of the early part of the term? So it didn't really make a whole lot of sense, but like nothing makes sense the last 2 years. But I hope that like we learn from that experience and come up with like new process so that in the future when we recognize these kind of unusual circumstances that we actually have a system in place to get these contracts started sooner rather than later. So
Yeah,
that's all.
I would, and it's interesting because COVID, in a lot of ways, not just clinically and from a public health standpoint, has changed so much of how we address the needs and respond so forcefully and efficiently to the community. But I get concerned that, particularly for small nonprofits or even medium to large nonprofits who are overwhelmed and really need to know that they can quickly respond to the community, that there isn't going to be administrative difficulties or budget difficulties that are going to leave them in a position of vulnerability being able to go forward. And so I don't know what those mechanisms are to provide assurance and resources to organizations going forward, and not just in an emergency, but with the acknowledgement that, particularly for vulnerable populations in San Francisco, we really need to think about how do we have a contracting process and a program development process that really sort of is as efficient on behalf of the agencies and the residents of San Francisco as we can possibly make it.
Yeah, and I'll add the word fair to
Yeah.
to Commissioner Guillermo's comment. But yeah, thank you. So I think that we are learning as we go with this. But do any additional questions or public comment on this item?
Commissioner, may I ask a clarification question?
Of course.
Ms. Ruggles or anybody, so just to be 100% clear, the vendor received no payment at all, and they won't until this contract's certified. So just because the commissioners are asking questions around the concern around the fiscal viability of the organization, and I know sometimes there's prepayments that we do. Did that occur for this vendor in this contract?
No, you can't do a prepayment you can't do a prepayment, but if you don't have a contract in place, you can't pay them. This vendor didn't actually submit their contract scope until February. And so, now I don't know exactly where it is, but yeah, you can't pay them, which is ideally why we don't have delays at all with new contracts and why we are trying to push earlier decisions and getting funding notifications out. But again, this was a particular contract for a particular issue that just has made it more challenging.
Thank you very much. So commissioners, if you could make a motion to put this on the consent calendar.
Yeah, I'll move to approve the contract.
And I will second.
Thank you, commissioners. And Commissioner Chung, I welcome you to, if you feel strongly, to mention this in your update on the meeting to the full.
Oh my God, I'm gonna like stand on a pedestal and.
Thank you again, everyone, for the presenters. We can move on to item 5, which is the DPH usage of grant agreements and proposed solicitation waiver process. And I'm going to share my screen to show the presentation.
So, hi again, it's me, Michelle, and I am joined here by Greg Wagner. And this is actually kind of timely based on your last comment. So this presentation, if you did look at it, probably seemed kind of boring, but it's actually super, there's a lot of work behind this, and I think is going to have a lot of help to us to change our contracting process. And so, do you want to next slide? All right. I'm not going to ad lib because I can't talk. So today, there's 2 points to today's meeting. One is we want to tell you about a change in the DPH contracting process, which really is going to primarily impact nonprofit contracts. This will all make more sense when I get more into this, but right now we use a contract template called a professional services agreement template. And there's procedures that go along with that. And we want to switch to the G100 grant agreement template and procedures, and then explain to you why and what that means. But really for efficiency reasons and to realign our eligible services to the city's administrative code that governs grant agreements. The second part of today is that to be in compliance with the 21.G grants administrative code and to implement this conversion, we'd like to seek approval. We are trying to seek approval for a proposed procedure for you to grant sole source waiver requests for new grant agreements. So one is to overview and one is to explain the request. All right, Mark. All right, so just briefly, though it looks dense. Right now, all of our contracts in DPH primarily that we use professional services contracts, and that's governed by Chapter 21 of the Administrative Code, and all our contract, which is governed by the Office of Contract Administration Purchasing, which is called OCA. They have rules, the admin code tells us what we can do, and we use this P600 template. If you look at the admin code though, Chapter 21 applies to services, and services are defined specifically to exclude grants to nonprofit entities that provide services to the community. So when we apply the standard Chapter 21 professional services requirements to our community-based service contracts, the requirements don't all fit, and they can be time-consuming. And right now, if you went to Department of Children, Youth, and Family, DCYF, or Homeless and Supportive Housing, or HSA, Human Services Agency, currently they all use grant agreements to contract with community-based nonprofit vendors. And in January, there's been updates to the admin code, were approved by the board. And so we're using this opportunity to jump onto the process. We were fortunate to be involved in the changes to the admin code. And so that's why we're now doing it. There's specific criteria for grant agreements. So the change really is going to apply to our nonprofit agencies mostly. I just want to also point out, because we don't use grant language this way, but grant agreements can be funded with general fund money. So the term really isn't just grant funding only. But the reason we want to do this change is that it will create efficiencies that will decrease contract processing time and really realign our services to the appropriate administrative code requirements for eligible services. And the change also, though, requires us to implement a process to obtain your Health Commission approval of a sole source waiver when the desired vendor will not be subject to a solicitation process. So Mark, next. Just to give you the comparison, P600 is what we have now. It's a professional services agreement. The vendor is the contractor. The key part is in red, and that is right now, or the key other part is you have an approval process for the sole source waivers that are part of the P600. And that you've probably heard, we come to every year. I'll talk about it in a minute, but Chapter 2142 of the admin code. The G100 is a grant agreement. The city is the grantor. So we're giving out the money. Could be pass-through grant, and it could be general fund monies. And just to point out that there's criteria to do a grant agreement. And so the services have to be for the general good of the people of the city. And so services, this is like fitting into their descriptions, which is just a little odd, but services that are performed for the direct benefit of the department. So that would be consultants like IT contracts or temp agency contracts for nursing or any of that. That is directly to benefit us, not the community, if you will. Just that's the definition. So those services will not go into grant agreements. And so it's for that reason, primarily, that what you're going to see is nonprofit organizations. And then the same across the board, services that are otherwise, you can't contract out civil service jobs. So that's one of the criteria. That's not an issue here for DPH, but the grant ordinance does identify sole source approval requirements, but then we have to implement it. So I just wanted you to have this sort of comparison. Next slide, please. So at a glance, I know this is dense, but essentially in the column that says requirements, those are all the things that the contracts office has to comply with when they're certifying a contract. And so you can see in the P600 column, all those things are required. But when you move over to the G100, some of those requirements go away. And so the requirements that are going away don't quite fit in all cases, and they also add a lot of time. And so why we want to switch to this is we want to make the process and the requirements align with the admin code and really align with what we're doing. So like PSC approval to contract out services, that's where you go to the Civil Service Commission and get authority to contract out services. And that's really much more, you don't have to do it for grant agreements. What you're doing it is, if you need to get a temp agency or any of those type of services, but it doesn't really fit for CBOs, community-based organizations, and it takes a lot of time. The 14B, local business enterprise, that's another requirement that really fits more to professional services. That's a goal that our city has for having subcontract goals given so that a vendor would have a subcontracted portion of their services to locally owned business enterprises. This is actually quite a bit of work, or you have to get a waiver. Our community-based organizations typically do not subcontract their work. They do it directly. And then secondly, 95% of our community-based organizations are headquartered in San Francisco. So it's just not a good fit. And then anyway, you can see that. And then the last one is this doesn't go through the purchaser OCA signature process. That can be time consuming simply because it's just another lot of steps. And in doing those steps, it takes time and follow up. The thing about one thing though that OCA does do is they provide their like a second look. Did you cross all your T's and dot your I's? And so we are also making this conversion at a time, fortunately, where we are finally being able to hire and fill the manager positions and add another layer of support in the contracts office that will allow the managers of each contract unit to really focus on quality control checks. So we don't intend to lose any quality control because we don't have a second level of purchaser reviewing these contracts. And then again, just to keep in mind, no other city department that has grant agreements goes to the purchaser. But that'll be, when you add all those things up, especially when you're starting a new contract, that will help decrease the time and I think better align the requirements to what a community-based organization services would require. So next slide, please. So when this new legislation happened, or not happened, there was an amendment, and the amendment was fairly significant. But one of the things that they did was made a requirement about sole source, that there had to be a waiver process. And I guess it didn't exist before. We never did grant agreements before. So on January 26, 2022, the Office of Contract Administration, which otherwise won't govern the approval process, was required to set out a requirement for grant solicitation or grant waivers. And they wrote the form. So we have their form. And if you have a board or a health commission, or a commission and a health commission, then that's who has to approve it. So what we're going to be asking, after I explain even what it is for a designee to sign the documents on behalf of the health commission. But anyways, it defines, so it's not, okay, well, let's go to the next slide and so first, I just want to tell you what you currently have, and then I'll explain more about the waiver process, the proposed waiver process. Currently, the Admin Code, Chapter 21, has a section 2142, which we call sole source 2142, which authorizes you, the Health Commission, to designate as a sole source our professional service agreement contracts that meet the criteria. In this case, it's all nonprofit. And so it was put into the admin code to address the contracting authority if there is a gap between starting the service and a solicitation process. So what we do now is the contracts office gives you a list of all of our contracts, all of our existing contracts and any recent ones and anyone that we might be contracting with. And we present that to you. It's a pre-approval list. You'll actually be getting it in June. And so that allows DPH to have advance approval if any of those contracts are awarded funding under a sole source agreement. So in this case, you don't sign off on individual waivers for each contract. What does happen though is, and this is not different, we will bring you the contract once the contract is a contract. And that's, after there's a sole source determination, that comes to the Health Commission if it meets your criteria. So, and then when we go to OCA to approve a contract, we just give them your approved list. They see that you've approved the contract that's on the list, and so it makes it a very efficient and streamlined process. But that part of the admin code is only applicable to the professional services, not to this 21G grant. So that's why OCA developed a grant agreement sole source waiver form. So we will continue our current process for the 2142 sole source waiver because not all services are going to switch from one process to the other. And so we will still need this because this is actually a very helpful existing process. But that's what you have now, and that's why we can't apply it. We hope to, but here, I want to go to the next slide, please. So what we're hoping to do is a two-part process for approving sole source waivers. One is we want to create a similar pre-approval list for your approval, just like we do for the 2142. So we wouldn't have to come back one by one for each proposed waiver. However, we have to work that out with the city attorney because of the language and the new admin code. So that's underway. But in the meantime, we are using with OCA put together, which is a waiver form. And the difference here is that each waiver request put onto OCA's waiver form would get approved one by one. And so what we are proposing, and I'll talk more about it on the next slide, but is to expedite the approval process because we have to have an approved waiver before we make the funding commitment. So that's essentially the first step in the contract development process. So we don't have a contract yet. We would just get approval of a waiver to continue. So the timing is potentially really off. We want to send out funding notification letters, and what we bring to the Health Commission are approved contracts that we're wanting to enter into. So to expedite the approval of the waiver, what we're hoping to do and what we'd like to do is have the Health Commission designate the Health Commission secretary as the authorized designee to approve the sole source waiver request. And that would be in accordance with an existing resolution that authorized the secretary of the Health Commission to sign routine documents on behalf of the Health Commission. So, okay, so that's that. And then can you go to the next slide, please? So if approved, the proposed grant solicitation waiver process would work like this. This is without a pre-approval list. So we would prepare each one on the waiver form and give it to Mark Morowitz to approve on behalf of the Health Commission. And each grant solicitation waiver would provide the documentation and the explanation for why we're doing it and why we need to waive the competitive solicitation. Once it's approved, just again, following the rules, we upload it into PeopleSoft that as a requirement for OCA. And then once it's approved, then we will continue on with the development process for a new grant agreement, AKA contract. And that will include the services that you approved in the sole source waiver, and assuming, and in most cases it would probably be yes, it would come to the Health Commission. It meets your approval criteria. So if it's a new service, if it's 100,000 or more, ongoing 500,000 annually, total contract. So can you go to the next slide, please? So I just want to give you a couple reasons why we seek a sole source waiver, which is really no different than what we do now. It's really kind of exactly the same. So right now, the primary difference is that the sole source waiver for the potential grant agreement is unique to each vendor, whereas you've been approving a list. And so you approve the list and then we provide the rationale. But the reasons that we do sole source agreements is we are using it to bridge a timing gap if a solicitation has expired and we don't have the new solicitation ready. A lot of our services are ongoing and a lot of our vendors are successful in rebidding a contract. So essentially the services are ongoing and we don't want a gap between old and new contract. Another thing that happens with great frequency once a year is that the board and the mayor allocate additional funding. And the expectation is that we get that funding into a contract to address the issue that was the reason for the add back funding in the first place. So, or, we've had a lot of emergencies lately, like COVID and Tenderloin and whatnot. So this allows us to get funding going, which we often do, and then we put the service out to bid. But that allows us to start and not wait a year for an important service to begin. Sometimes we have grant applications where the grantor and the department have collaborated on the development of the grant, or they're the vendor that does the service, and so they're named in the grant. So when we submit the grant to the federal government or the state and they approve it, then we have the named vendor. So that is one other time. And also, so that would be a sole source. And then I guess I covered the last one before, but really when something comes up that's emerging and critical, then if we, like the street crisis response team or things like that, that are designed to immediately help, and we don't have time to get everything done in advance. So these are the same exact reasons why we do sole source agreements now under Chapter 2142. Each year we bring to you a list of everything that we've done as a sole source. So you see that. You see what contracts we've entered into, what programs within a contract, why. And so we bring that to you every year. So I think, was that the last slide? So the next step would be that we would bring this to the full Health Commission to consider approval. And Mark, do you have the waiver? Sorry, I didn't, I think it was in the email, just to show the sample.
Sure, give me a second.
Sorry about that. I didn't think
I'm
of it.
gonna unshare and then I'll come back. Give me a second.
If it's the grant solicitation waiver, it is included in the packet.
Yeah, it should have been. So that's an example of a contract waiver that we would request. And that one, that solicitation is expiring. And so if you change the contracting authority, you have to do a new contract. You can't switch to sole source within the same contract. So we can't extend the existing contract. There's something going through the board right now because of COVID and hardships of getting all these solicitations done. But in any case, the request for this is a 1-year contract to continue the existing services for 1 year, giving us the time to complete a solicitation and select either the same or a new vendor to continue the services. So this solicitation request, and this again is their form, is for the purpose of continuing the services for 1 year. But we'd like to do this as a grant agreement and not as a professional services contract. Again, because it'll be a new contract, we can skip the 14B, we don't need a PSC, we don't need LB waiver or LBE goals. And so that's why we're hoping, or that's an example of why we would use a grant agreement.
So I had a question. So then this process would it happen? Would it happen after programmatic details have been worked out? So we wouldn't be able to expedite the process until a program has been developed, or is this in the example that you're showing? Is it necessary because it's an existing program and you're just waiting for the solicitation to be formalized or completed?
The waiver, so usually we find out about funding, new funding, a program person will come and say, I've got this, I have this, or the board gives us an add back list. So then we figure out, does this money expand any existing services that are authorized by an existing solicitation? And if they do, we don't need a sole source waiver, we just expand an existing contract program. So at that point, if we determine like, oh, we don't do this at all, or it's new, whatever, then this would just be one of the things that we have to check off that we're doing. The sole source form. So we're looking for the way that makes it the easiest, like we create the form, but using the grant agreement will expedite the process simply by virtue of having less outside a DPH places involved or waivers required that we would otherwise get. So this contract, this example, would be a new contract. So we would still, if we did a 2142 sole source, which is what we would do, the professional services, then we would still need to go either get a waiver or comply with 14B. Like we'd have to go through these processes again. So if we don't have to go through the processes, that is going to expedite the processing of a contract. not going to the Office of Contract Administration can save a month. It just depends. Like we all have staffing problems, and it's just one more place that we don't have to seek.
I get it. Okay, thank you.
I-
Commissioner, oh, sorry, Michelle.
I'm done.
Commissioner, I would just say I think from the commission's perspective, it's gonna feel similar to the current process in a lot of ways. It will just be that back end part where we're waiting and trying to shove a round peg into a square hole or whatever the metaphor is. And the benefit will really be felt by the program staff and the vendors from being able to move the dollars out the door and in a way that fits more perfectly the things that we're trying to do.
Got it. Thank you.
So I really appreciate, like the intention that goes into creating this proposed process. And, like as I mentioned a while back, and the onset of COVID, that I think that if there's a way for us to expedite, like these kind of approval process, like I am here to support it. With that said, being somebody who was on the Human Rights Commission before coming to the Health Commission, I also get educated about like the importance of like 14B, as, especially like a lot of times these are minority-owned businesses. So while this is a little bit different because these service providers, usually a lot of them are service providers, not going through that process means that these contracts don't actually go through a bid process. Is that right?
So, grant agreements are supposed to go through a bid process, just like all other services. The sole source agreement, the not 14B is for all grant agreements, but I should say that the grant agreements are for services. It's not for it, so it is going to fall out that it's community-based services. It's the, Baker Places, it's the Feltons, it's all the contractors that are providing, it's IFR, Latino Commission, it's all the vendors that are providing services to in the community, because that's a criteria you have. And so those vendors exist in they're from San Francisco, just about 95%, right? They're headquartered here. So, and they're headquartered here. So I think, and they also don't subcontract typically their services. Like they provide outpatient treatment. So to figure out a goal that would be applied to that kind of a service doesn't really fit. So we end up 99% of the time, 98% getting a waiver. But to get a waiver, so I just think it just doesn't fit really, or it hasn't fit judging by the number of waivers.
Yeah, I get that part because, like we're not like the public utility commissions, and we're not doing a whole lot of the kind of like upkeeping of like the reservoir, for instance, like and things like that, and that we encourage local builders to bid on those, and we give them a bid discount when they bid. But this
Right.
is very different, right? So I think that that's the conversations, longer conversations, in addition to the conversations we're having here, is that what actually makes more sense when it comes to being LBE. So I think that that's something that we ask a lot. But the things that we ask a lot is, the whole software, for instance, a lot of time, like software companies that we use to develop softwares are not from the Bay Area, not even from California.
Right. So those vendors are for profit generally, and they won't qualify for a grant agreement because they're supporting the department directly. They're not supporting I mean, it's a weird, but they're supporting the department. They're developing IT solutions. And so I know Rob Longitano is still on here, but I know that for those type of contracts, there are LBE goals assigned. It's just that it doesn't local owned business when all of our CBOs are local owned business. It's just a weird sort of concept that we end up getting waivers for. And if we get waivers 100% of the time or 98, is it even like, just to me, it says it doesn't really fit the process, but
Oh yeah, I understand that. I remember when I first got on the commissions that we actually get that sole source lists every year as a list that don't really change a whole lot. And and I've been wondering about that as well. So, but this also seems like there needs to be a little bit. So, is this going to go to the Board of Supervisors, for
no,
administrative code change?
it's already done.
Oh, okay. All right.
The Board of Supervisors, the admin code already included a section on grant agreements, but they updated it last July. But with the final rules and regulations coming out in January, it went to the Rules Committee, I guess is what it's called. So this is something, but the difference now is that I think that there is a form that OCA proposed or presented that departments need to use, because I don't think that that process had been defined. And after all the sort of crazy things that happened around the city, Supervisor Stephanie's office took the lead in updating and strengthening the guardrails around using grant agreements. And so that was one thing that came out of it was the waiver process. So it's not, it isn't unique to DPH.
So this is really us taking that legislation that the board had passed and saying, okay, we're going to put in a process to take advantage of this new option that's available to us.
Yeah, well, consider how many months you save. Like that's definitely a huge advantage. And and thank you for the clarifications. I think that it's really important because like one of the things that we want to strive is, to maintain transparency in the process. Like for the other like bid process, a lot of times, like it gets very convoluted, but that doesn't happen in the health department. Not the same. So I'm not criticizing any department, but yeah, but like when it involves human, there's always mistakes and sometimes intentional, but not here. So yeah. So thank you for the clarification. So and you will be presenting this to the full commission on the 17th for consideration. Is that right?
Yes, they will. And commissioners, actually, Ms. Ruggles and Mr. Wagner, if I can provide two quick things because I met with Michelle and her team to discuss this and try to figure out how to present this to you all. And my understanding is that this is only used for sole sources. So and correct me if I'm wrong, of course, Michelle and Greg, but so this would be the same thing that happens now. So like, let's say during COVID, there would be a quicker process to get those COBA contracts in order. And then they still go out to bid when the time is right. So this isn't something that circumvents that, Commissioner Chung, my understanding anyway, where this is like a secret back door where we don't have to do that. This is let's get this out the road and the services on the road and happening as quickly as possible so that then the bidding can happen a year or 18 months later. Is that correct, Michelle and Greg?
Yeah.
Okay, so that's really important, that this isn't like...
Yeah, I would say that is an important sort of overview statement to make or description to make as you present it to the full commission, because otherwise people are, rightly or wrongly going to just sort of listen to the presentation and may incorrectly assume that this is for all contracts or all grants and all kinds of circumstances. But limiting it to sole source, and then also being clear that this, that the competitive process, if it's needed to continue the types of services that are being provided under the sole source, that's an important thing also to sort of raise up front, I think. And then just a quick summary in terms of, basically what you're the goal here, as you stated, but maybe more strongly, to really make it easier for services to be provided to residents by the nonprofits who are providing those services in a timely manner without having to worry so much about any administrative barriers that are not as germane, right? And in fact, as you said, generally get waived anyway, right? So I think that there's just some key points that might need to be, I know you had them in the presentation, but maybe emphasized a little bit more upfront, and then you can go into the description of the process.
And to add to that, I think that this is also, it doesn't mean that it is business as usual, that, the sole source providers would always be the same sole source providers, because there might be new community-led organizations that are that's launched that's more appropriate in terms of providing these services, and we need to be able to recognize that and not to discourage like new nonprofits to be established. So this would not be a process that would discourage, community-led effort. Like if they decide, there's another trans-led organizations that are more appropriate in providing trans services, that they will be able to use this process to partner with the city.
Yes.
Thank you. Those are both helpful in terms of how we emphasize and frame.
Yeah. So yeah, because just like following the presentation was a little bit hard, and so I got lost a couple of times. But thank you for clarifying it.
I want to just make sure, just to clarify one thing, that like the front part of the presentation, like that could be for any contract or any grant agreement that we go out to bid, we put it into a grant agreement. So that, right? So it does apply to all contracts. The sole source is a secondary process when we need to use one, because we don't have sole source list. And I wanted to say to you, though, just to clarify too, when we come to you with the list of 2142, it is always pretty much the same because it's all our vendors. But what's actually nice about having, so you have a list, you've pre-approved it, and there's the list. So if someone's not on it, it's more work. But this actually, since it could be on it is on an individual basis, then there is a way to bring in somebody that's on an individual basis and get a waiver approved. The waivers, like right now for 2142 waivers, we usually have a contract that's 18 months. That gives us the time to put something in place. So it's not a permanent, but yeah, we'll focus on that. And you said it, both of you, much more eloquently, and I hopefully wrote it down to capture that. But yeah, so that would be all I wanted to clarify. Thanks.
Thank you.
Thank you very much, Ms. Ruggles and Mr. Wagner. Commissioners, is it okay to move on to the next item? Okay.
Yes. Is there public comment on this item, or we
There's
don't
no,
take
there's no on the public comment line
Okay.
anymore. So I will let you know if there is, but let's assume that there's not going to be. Item 6 is emerging issues.
I have none.
Okay.
Not so much in emerging issues, but actually it's an afterthought to the previous item. Like, so maybe like once this is approved and adopted, we should like have a way to come back and look at, like how it actually reduced time, like, because, that's if that's the goal, like we would like to know how successful we are in getting that goal met.
And Commissioner, would you Would you like that on a one-time basis, or like add that to our annual calendar where this committee reviews and checks in on that process? Just
No, yeah, that would be like overstepping if we
Okay.
have to like ask them to do that annually. But I think that because it's a new policy, you know, it would really be helpful for us to know how to support staff for like carrying on these like new administration process.
Thank you. We'll figure out how to build that in once you all look at it on the 17th.
And that, you know, like our commission secretary would not say that we have too many of these contracts to sign, the waivers to sign. Yeah.
Thank you. That's great. All right. There's no public comment for item 7 because there's no one here for that. And so commissioners, you're at a consideration for adjournment, item 8.
I move to adjourn.
I second.
All right. Thank you. I'll take that as an adjournment. Thank you all who were still on the line for presenting and contributing, and have a good day.